Diabetes insipidus is caused by the decreased or absent production of the antidiuretic hormone or vasopressin by the posterior pituitary. This leads to electrolyte imbalance in the body. Vasopressin binds to B2 receptors on the renal collecting tubule, activating the GS-adenyl cycling system, which increases the cyclic 3,5-adenosine monophosphate or CAMP. This will lead to the phosphorylation of preformed aquaporin-2 water channels, which promotes water flow in the collecting duct. However, since vasopressin is absent in diabetes insipidus, the body is unable to retain free water and hypernatremia occurs. Prion diseases are neurodegenerative diseases caused by the conversion of the normal prion protein or PRQC with a primarily alpha helical structure into an abnormal form called proteinaceous infectious particle, which has a primarily beta PTG structure or PRPSC. The normal prion protein is responsible for synapse formation and neuroprotection. That's why in patients who have these kinds of diseases, they have cranial nerve reflexes, obtunded level of arousal, cerebellar ataxia, and dementia. Prion diseases are neurodegenerative diseases caused by the conversion of the normal prion protein or PRQC with a primarily alpha helical structure into an abnormal form called proteinaceous infectious particle, which has a primarily beta PTG structure or PRPSC. The normal prion protein is responsible for synapse formation and neuroprotection. That's why in patients who have these kinds of diseases, they have cranial nerve reflexes, obtunded level of arousal, cerebellar ataxia, and dementia. Acute fatty liver disease is uncommon but a fatal disease for pregnant women. This is due to the defective placental fatty oxidation in which the chromosome 2, gene G152AC, and E474Q is inactive. This will lead to the deficiency of the long-chain 3-hydroxyacyl-CoA dehydrogenase, which will result into the accumulation of the medium and long-chain fatty acids. This process is combined with hepatocytes producing ammonia and lipotoxicity, which will lead to hyperglycemia secondary to evolving hepatic failure. In addition, due to fat infiltration in blood vessels, the kidney, pancreas, brain, and bone marrow are also affected. In this case, I have learned that ingestion of a toxic dose of nitroprusside will lead to cyanide poisoning. Cyanide, which is an inhibitor to a mitochondrial cytochrome, will disrupt the electron transport chain and will compete with oxygen at the binding site, which will lead to cellular hypoxia and inability to produce ATP. In summary, all processes that require ATP and oxidative phosphorylation will be inhibited. To compensate, rate of glycolysis will be increased, but since under these anaerobic conditions, pyruvate dehydrogenase, the TCA cycle, and oxidative phosphorylation are compromised. Thus, 1 mole of glucose will only be produced along with 2 moles of ATP and lactate. This explains the lactic acidosis during anaerobic metabolism when we are engaging in strenuous physical activities. Lactate cannot be reused by the cells and is transported to the bloodstream and causes cramps and muscle soreness. In the case of sepsis, I have learned that lactate is not the only used biomarker in identifying the disease. Pro-inflammatory cytokines, chemokines, C-reactive proteins, and procalcitonin can also be used in detecting sepsis in the body. Sepsis is an exaggerated response of the body due to infection, in which in this case it is caused by a foreign body, with an excessive release of the interleukin-8 and other inflammatory mediators. I have learned that free radical nitric oxides cause organ injury in sepsis, and I also read in another journal written by Aid and other colleagues in 2016 that pro-inflammatory cytokines, interleukin-1 beta and interleukin-18, generates T helper response, but these cytokines also promote vasodilatation and immune cell extravasation, including cell death. Diabetes mellitus is not new to me since it runs in both sides of my family. The diabetes mellitus has 2 types, type 1 and type 2, wherein the beta cells of the pancreas, being the source of insulin, are disrupted in the type 1, while insulin receptors of the tissues are affected in type 2. In this case, it is about type 2, wherein fatty acids inhibit insulin-stimulated tyrosine phosphorylation of insulin receptor substrate 1, or IRS1, and IRS1 associated phosphatidyl inositol 3 kinase activity. This leads a defect in the glucose transport, and commonly seen among patients are polydipsia, polyphagia, and increased urination. G6PD deficiency is an X-linked recessive disorder that is characterized by decreased levels of an enzyme glucose-6-phosphate dehydrogenase that leads to the destruction of RBCs, which results to the hemolysis of the red blood cells and hemoglobin damage. Hemolysis causes the tea-colored urine and increased bilirubin, which will lead to jaundice. In addition, it also leads to the accumulation of hemoglobin, which are called Heinz bodies, and they become bite cells as they appear to be bitten due to damaged membrane. Medium-chain acyl-CoA dehydrogenase deficiency or MCAD deficiency is an autosomal recessive disease wherein the lack of the enzyme fatty acyl-CoA dehydrogenase impairs the first step of beta oxidation. This leads to the buildup of medium-chain fatty acyl-CoA in the mitochondria, which eventually leads to the depletion of both free CoA and acetyl-CoA. Since the CoA cannot be converted into free CoA, beta oxidation, ketogenesis, TCA cycle, oxidative phosphorylation, and gluconeogenesis are all compromised. This is the reason why patients with the disease presents with severe hypoglycemia and hypoketosis after a prolonged fasting. To manage the disease, a careful diet control, which includes avoiding high-fat diet and increased carbohydrate meal for ill children, are advised. Tay-Sachs disease is an autosomal recessive disease that is a result of a deficiency in beta and acetylhexosaminidase. Gangliosides are important in cellular recognition and communication, and its synthesis is from the formation of ceramides followed by the addition of sugars and a sialic acid. Because of the deficient enzyme, buildup of ganglioside GM2 in nerve cells of the brain occurs and neuronal dysfunction follows. Also, patients who have Tay-Sachs disease can be seen with cherry red spots in the macula, and for children, the inability to sit and hold, along with eye movement anomalies, can be seen. Hypertriglyceridemia or lipoprotein lipase deficiency is inherited in an autosomal recessive pattern, and patients with LPLD often present with abdominal pain, hepatosplenomegaly, and eruptive symptoms. In this case, there is a deficiency in lipoprotein lipase, which results in increased levels of both chylomicrons and VLDL, or very low density lipoprotein. The deficient enzyme disables the body in properly digesting fats, leading to high levels of triglycerides in the blood. Due to the buildup of chylomicrons, inflammation of the pancreas occurs, leading to the inability to make enzymes needed by the body to digest food and less insulin. That is why patients with LPLD also present with diabetes. In Graves' disease, the inducing action of thyroid-stimulating hormone is continuously interrupted by a thyroid-stimulating immunoglobulin, which causes hyperplasia to the gland that leads to an increased metabolic rate, tachycardia, tremor, nervousness, thin skin, weight loss, and non-tender thyroid enlargement. This can be treated by using antithyroid drugs such as propylthiouracil or by surgical resection via thyroidectomy. Porphyria is one of our group's reports, and here, the patient has an intense worsening abdominal pain, which is non-specific indication and is described as cramping, along with nausea and vomiting. In this case, there is a deficient enzyme which is called hydroxymethylbilin synthase, and for confirmation, there is also an elevated levels of both serum and urine aminolevulinic acid or ALA and porphobilinogen or PBG. There are other types of porphyrias like chronic hepatic porphyria or porphyria cutanea parda, which is the most common porphyria, acute hepatic porphyrias like ALA dehydratase deficiency porphyria, erythropoietic porphyria, and hereditary corporopporphyria. Sickle cell anemia is an autosomal recessive gene disorder wherein there is a substitution of valine for glutamate residue 6 in chromosome 11p15.4, where the beta chain of hemoglobin is encoded. Because the solubility of the deoxyhemoglobin S is reduced due to the exposure of valine on the surface of the beta chain, it will precipitate inside the cell, causing the sickle cell-shaped RBC, which is at high risk to hemolyze. For diagnosis, peripheral blood smear is used to screen for sickle cell disease, and confirmatory tests are hemoglobin electrophoresis and HPLC. Treatment for sickle cell anemia includes oxygen administration, pain management, and hydroxyurea administration. Blood transfusion and gene therapy are also included. Liver cirrhosis is an advanced form of liver fibrosis wherein there are developments of regenerative nodules in response to chronic liver damage. The main causes of liver cirrhosis are hepatitis B and C, as well as metabolic, toxic, or drug-induced and autoimmune causes. Normally, we have blood ammonia coming from the hydrolysis of urea and other nitrogenous compounds in the amino acid transamination of our skeletal muscles. But in liver cirrhosis, there is an increased production of blood ammonia, which compromises the brain. The golden standard in diagnosing cirrhosis is liver biopsy, but markers such as increase in ALT, AST, and during serologic testing are also used. Anorexia nervosa is a mental disorder where the patient avoids eating in fear of becoming obese. In comparison with bulimia, a person with anorexia stays away from food completely. Medical complications include dry skin, lanugo, bradycardia, hypotension, dependent edema, hypothermia, infertility, cardiac failure, and worst of all, death. Due to depression, patients may also experience satiety withdrawal. All of these complications come from lack of food intake, and as we all know, amino acids and caloric intake provides energy to the body. Counseling and cognitive behavioral therapy can be given to the patient. Sanfilippo syndrome is an autosomal recessive gene defect of the chromosome 17q25.3 exon. It is classified as a mucopolysaccharidosis type 3, which refers to one of the 5 autosomal recessive neurodegenerative lysosomal storage disorders. In this case, there is a degeneration of the central nervous system resulting in mental retardation and hyperactivity. The central nervous system degradation is brought by the damaged neuron phagocytosed by microglial cells because of the increased GAG and increased ganglioside, which leads to inflammatory processes and CNS exacerbations. Other complications of Sanfilippo syndrome include skeletal pathology, hepatosplenomegaly, and hearing loss. In this case, I have learned that there are different kinds of vegetarian diet. Because vegans have low intake of protein and calcium, they are at risk of having bone problems, and they are also immunocompromised due to the decreased zinc in the body. A decreased vitamin B12 plasma concentration also leads to CNS degradation and macrocytic anemia. Usually, patients are referred to nutritionists and are educated on the nutritional diet needed by the body. Alzheimer's disease is not uncommon to me because when I was an undergrad student studying physical therapy, I've had a patient during my internship with this kind of disease. Here, neurofibrillary tangles and senile plaques are seen because of the accumulation of hyperphosphorylated tau and APP or amyloid precursor protein. This leads to cerebral atrophy, and patients are presented with short-term memory loss, disorientation, loss of motivation, and mood swings. Aside from the presence of beta amyloid plaques, mutation of presenilin, which alters the normal ER function, can also be a mechanism linking ER stress to Alzheimer's disease. Folic acid is very essential to our body. Folate, which is converted to tetrahydrofolate by DHFR, can be converted into 5-methyl tetrahydrofolate or into N5N10-methylene tetrahydrofolate. These are both important because 5-methyl tetrahydrofolate converts homocysteine to methionine with the help of vitamin B12. On the other hand, N5N10-methylene tetrahydrofolate is for purine synthesis, which is essential in synthesizing our DNA. Because of alcohol abuse, impaired metabolism, and vitamin deficiency, folic acid deficiency occurs by inhibiting the conjugase that would convert the monoglutamate form of folate into its methylated tetrahydrofolate form. It is important in pregnant women since lack of folate would cause neural tube defects on the child. During starvation in the liver, the TCA cycle is slowed because of the drainage of the TCA intermediates to gluconeogenesis. Proteins continue to be broken down to replenish TCA intermediate. In the muscle, activity decreases as a result of mobilization of muscle protein, which in time slows down as starvation increases. The adipose tissue breakdown of tags to fatty acid is accelerated. In the brain and central nervous system, adaptive changes occurs, allowing the brain and the CNS to use ketone bodies as energy sources. I have learned that in marasmus there is a deficiency in caloric intake, while in kwashiorkor there is a deficiency in protein intake. They both have growth failures, but edema is present only in kwashiorkor. For treatment, Resumal is used for severely malnourished children, IV rehydration as well, vitamin supplementation, and continuous breastfeeding. Acetaminophen overdose was introduced to us during our xenobiotics lecture, and in this case, increased acetaminophen leads to an increase in NAPK, or the toxic metabolite, which leads to liver necrosis. Because of toxicity, the GSH, or the glutathione defense mechanism of the liver, is disabled, thus detoxifying cannot be done. Treatment includes activated charcoal for less than 4 hours, IV of N-acetylcysteine, which will begin within 8 hours of ingestion, and liver transplant after 36 hours. Rhabdomyolysis is a disease wherein there is a muscle breakdown which results in the release of myoglobin in the blood. It is triggered by muscle injuries, which in this case, the patient was a marathon runner. Normally, hemoglobin is not toxic to the kidney, but since there is an accumulation of myoglobin, it decreases the pH level of the urine, thus resulting in the oxidation of myoglobin to become heparin that is now toxic to the kidney. Since myoglobin is already present in the urine, it gives the urine its dark tea-colored appearance. In diagnosing rhabdomyolysis, there is an increase in blood serum creatine phosphokinase and increased potassium on electrolytes. Also, there is an increase in serum lactate. Adenosine deaminase deficiency is a rare condition in which the normal immune response is not functioning properly against pathogens. Here, there is a mutation of the ADA gene which is autosomal recessive. This leads to the elevation of adenosine and deoxyadenosine, and the deoxyadenosine is converted to the ATP, resulting in inhibition of deoxyribonucleotide biosynthesis, which triggers the apoptosis of the T and B lymphocytes. The treatment for adenosine deaminase deficiency is adenosine deaminase replacement, haploidentical bone marrow replacement, and ADH gene therapy. In this case, the human immunodeficiency virus attacks the CD4 cells, and DNA synthesis comes from the HIV RNA. Then the HIV DNA integrates into the host DNA, to which HIV RNA synthesis happens and splicing comes after. After that, full-length HIV is released into the cytoplasm, and translation of viral core and envelope proteins occurs, leading to the assembly of the new virus particles. HIV can be from unprotected sexual intercourse, having another sexually transmitted infection, sharing contaminated needle or syringes, and accidental needle stick injuries. Lyme disease is a spirochete disease caused by Varroa burgdorferi or tick bites, wherein the patient presents with joint pain, myalgia, bullseye rash or circular rash, headache, and neurologic changes. In diagnosing Lyme disease, serologic testing, Lyme ELISA test, Western blot, PCR, and CSF analysis are used. Doxycycline is the treatment of choice during the early stage. Other treatments include penicillin, cephalosporin, tetracycline, and macrolides. An example of macrolide is erythromycin. Herpes simplex virus is an infection that is caused by HSV1 or herpes simplex virus 1, which primarily causes oral herpes, and HSV2 or herpes simplex virus 2, which causes genital herpes. Both diseases are acquired regardless of age through direct contact with an infected person. The virus replication begins with the attachment of the virus to the host cell surface, followed by the fusion of the viral envelope and cell membrane, and release of the viral nucleocapsid into the cell cytoplasm. The nucleocapsid attaches to the nuclear envelope, and then the viral genome is released into the cellular nucleus. I am a visual and an auditory learner, and I have learned that memorization is not the key to success. I learn whenever we have a case discussion because I can apply the basics to the cases, and all my learnings can actually be used to the medical conditions of my future patients. Personally, because it is the second time that I'm taking this subject, I was demotivated at first, but then one of the professors told me that I should come back stronger for my future patients. Spiritually, I became closer to God because I always ask for help, especially during our module exams, which are very, very hard. And what I can share with others is that it is not enough for you to use just one source. If you want to learn more about the topics, you should also dig to other resources, such as journals. And again, memorization is really not the key to success here in biochemistry.